Residents on the streets of Abuja, some adhering to the COVID-19 guidelines, while others are not so keen. Yet, Nigeria is witnessing an increase in cases of COVID-19 since the government announced the discovery of the Delta variant in June. Government officials are now warning citizens not to worsen the efforts by health officials to combat the spread.
The Presidential Task Force would like to caution Nigerians on home-based care, as there may not be enough facilities and personnel to manage patients in times of emergencies. It is in this way that concerted efforts have been made to ensure that oxygen is available for patients in all the 46 facilities.
Nigeria's medical sector has been stretched thin by the burden of tackling the pandemic alongside other diseases like cholera, malaria, and tuberculosis. On top of that, the country is behind on its vaccination target of 40% before the end of this year, which is about 80 million people. So far, only around 2 million people out of more than 200 million have received both doses of the AstraZeneca vaccine. So far, Nigeria has recorded just over 2,000 deaths, a far lower death toll than other countries like South Africa, where more than 72,000 people have died from the disease. But experts say Nigeria's data may not be accurate.
The deaths may not have been as experienced in some countries, but there are schools of thought that say that this may just be a tip of the iceberg, because our testing capacity is not so high, even though it has been ramped up. I know NCDC has done a lot of effort to ramp up testing. But of course, when you look at the population of 200 million plus, we have not still tested enough. So it is possible we have a lot of missed cases.
Nigeria's Center for Disease Control says it's partnering with the EU to help improve its testing capacity and access to vaccines. The government says it has received around 4 million doses of COVID-19 vaccines in August and is expecting about 41 million more in September in order to inch closer in meeting its target.
The major challenge we are having is the vaccines, supply of vaccines, which we heavily depend on donations from the COVAX facility. Okay, so that is basically the major challenge we are having. In terms of capacity, for logistics management, cold chain management, human resource, we are using the polio elimination program to, effectively manage the rollout process. So that is really not a huge challenge per se. So the major challenge is actually the vaccine itself.
For now, the government has also restricted flights from some high-risk countries, including Turkey, Brazil, India, and South Africa.
The hope is that these efforts will help curb rising cases from a virus that's putting over 200 million Nigerians at risk. Phil Ihaza, SABC News, Abuja.